I don't think that we were fully prepared for a pandemic. I don't think anyone was in the world.
We didn't know anything about COVID as practitioners. We knew nothing. We knew what was on the news. We knew what the CDC said.
It happened fast. You know, the lead up to it seemed very slow and, you know, well, I wonder if it's going to happen. I wonder if it's going to come. And then the shoe dropped.
The numbers started increasing. And then that is when it dawned on me that, oh man, this thing is really, really going to be bad.
There was so much death and people were so sick, and no matter how hard you tried, we couldn't save them.
We would take care of them for weeks. It's not a quick disease. You know them, you get to know these people, and you knew that their outcome wasn't gonna be good. You kind of can tell.
I just tried to keep my guard up and tried to make sure I continued to do everything correctly.
So I think definitely in that first week, you know, everything changed so much. Constantly just trying to communicate out to everybody what was happening and what we were doing.
Teams that had never really worked together before were working together. It was all hands on deck in a way that I've never seen before in the hospital alone, but also with other hospitals and collaborating with other teams.
If we didn't have that tie with each other, and particularly through Connecticut Hospital Association, I don't think we would be as successful as we have been throughout this pandemic.
It really is a time that has given us the opportunity to kind of look within and see where we are and then move forward.
I think one of the things the pandemic showed us is that we have to always be willing to change course.
We need to be flexible. We got to be adaptable. At the end of the day, you know, we're all here for each other.
As the hits came, we learned. So I think that, you know, season 3 COVID, we were way better than season 1, and the patients were better off.
I feel like I'm the same person, but I know a little bit more, and like I try to understand patients more and coworkers.
I'm in awe. I mean, we sort of figured out a game plan and we assembled a good team.
We know so much more now than we did those first months, and we can stay on top of things. We can anticipate what's going to happen.
We just worked as a team efficiently. I absolutely feel like we participated in a piece of history.
Nothing in medical school can prepare you for this. Nothing. When it comes from a patient and a family, it's immense, the gratitude. It's why I decided to do this. So why wouldn't I come back?
You have to love it. You have to have compassion. You have to really want to keep doing it.
My family instilled in me a desire to help others.
We choose to come to work and do our best every single day.
Giving back to patients and seeing them come in not feeling so well and making them better.
Working as hard as we can to help you and your family.
Being available for patients who really, really needed it at that time. The benefits of that outweighed the risks.
You know, through the good times and bad, we all are able to kind of pull together, and we're all staying in this field for a reason.
I'm here in a purpose. I'm in the hospital to help people.
Ever since I want to say 16, 17, I wanted to be a nurse.
When I went to college, it was always about the plan of going to medical school and becoming a physician.
Ultimately, I think I was born to be a pathologist.
I wanted to be a doctor. I wanted to make people feel that someone was there to do the right thing and keep them safe.
When I see that at least at the end of the day, I was able to do something that got the patient better.
It really makes me feel like I'm doing something good for the public.
To be there for somebody, to empathize with them. I truly love my job. I like being there for people, helping them.